And I just want to say some things that maybe haven't been said. First of all, 15 years in the emergency room, I've seen the devastation of cigarettes every day. And it's, I don't think you can find a disease process that isn't affected by smoking. I think most of us know that. It's amazing to me though, if you, just the impact, and if I could ask any patient who's had chronic COPD, chronic emphysema, chronic congestive heart failure, if they could go back and change the past, I don't think I could find a single patient that would say no, I wish that everybody continued. A couple comments that I haven't been brought up about e-cigarettes, and I struggle with my feelings on this. I have feelings on both sides of it, but I've done a little bit of research, and I have a copy of The Circulation, which is an article from the American Heart Association that just came out in June of this year, so hot off the press. So 3 points. One is the WHO organization, the World Health Organization, and the American Heart Association. When you look at the evidence, there still is just not good evidence about the safety of e-cigarettes. There's this assumption that they are safer, and I think there's probably a safe assumption from smoking, but when you look at other health consequences, we still know nicotine is a strong cardiotoxin. We still have hundreds of cases of people presenting to the ER every year with nicotine overdoses on e-cigarettes, particularly youth, if you look at the studies. The endless compounds still, propylene glycol is one of the common constituents in e-cigarettes that causes respiratory and eye irritation. So if you take a large number of people in a small enclosed space, it's hard to believe you're not going to get some irritation. Second, I was optimistic several years ago about, I have a lot of patients who smoke, and it's always a challenge. How do we encourage patients towards cessation? We try to use pharmaceuticals, we try cold turkey. The whole concept of e-cigarettes seems to make a lot of intuitive sense. The problem is it's not working well. What you find out is patients go to dual therapy. They're on dual, they're both smoking and using e-cigarettes. When you actually look at some of the studies, actually your cessation rate is less on e-cigarettes as opposed to going cold turkey or using pharmaceuticals. I think it's more of a acceptable, people feel like their risks are less, and so they tend to be a little less aggressive about stopping smoking. And finally, my primary reason for being here, I have 2 small children. I have an 8 and a 5-year-old. My biggest fear as a parent is drug use. And I have several patients that are junior high and high school that are in my clinic that are frequent users of e-cigarettes that have never touched a cigarette. So my concern is the entry into people starting to use these products who traditionally don't smoke, but it's an easier way. It seems to be more socially acceptable. So I feel like as a physician, as parents, as society, we have an obligation to protect our